All right, so this is the story of the rich will remains rich and the poor will always remain poor. Because, you know, as I say, my channel, I'm just talking about a few things here. And I tell you, poor people have it hard, but me things say, you know, the family members, them, yes, some of them are enabler and some of us are, you know, not trying. Everyone, welcome to the channel. Thank you so much for tuning in to the ThinkNursing channel. So I just want to share something with you because, you know, even though sometimes we're in certain situations, I think, you know, family members, we need to kind of put out a little bit more effort into taking care of our relatives. The onus cannot only be on the patient themselves, because some of these patients, especially our elderly folks, they're not able to do certain things. And if young persons are in the home, I feel that they should be playing their part in taking care of our patients, you know. So I went into the home to see a patient, and while I was waiting for someone to come and open the door, I saw this young lady. When I tell her, the girl pretty like a money, yes, I saw this beauty walking out the house. And when I was there, I was like admiring how she looks. All right, she's looking real nice. And so I was there and still waiting because she never allowed me to go inside. So after she went ahead, got in her car, left, I was now asked to come inside the home. And when I got in, I tell you, I was just in shock. And the reason why I'm in shock, as I say, I visit patients on a regular basis, and the home environment, you know, it is what it is. You know, some persons, that's what they can do for themselves, and you just have to accept it. That's their home, that's their comfort. But I cannot understand a home that has young folks in it. Yes, I'm talking about people like my age group and younger. I'm not talking about children. I'm talking about persons who are responsible adults. You understand? Young women in society especially. Because I kind of understand the men. Some men are not that tidy. They're not that, you know, together. So I can understand when a man plays no look like there's a woman there. But what I cannot understand is for our young women out in society, how is it that we're living in some homes that, you know, it seems like we don't know how to take up a broom, we don't know how to rearrange and make the place look more presentable. We're not helping out with bathing our relatives, our mothers or fathers. We're not trying to help out and make these persons, you know, a little bit more cleaner, especially knowing the fact that persons are coming to the home. You know, one thing I appreciate about, you know, my culture are, you know, you have some persons who are just like that, regardless of culture. They just know that regardless of where home is, what home looks like, whatever home is for that person, they're gonna give you the best presentation at all times. You understand? And so I cannot understand why a lot of these homes that I see where young persons are at, why the homes are looking like that. As I say, I was just shocked to see that this beautiful young lady walked out of the house, and when I went in, my nose was, you know, sniffling. I'm okay with my nose, like, you know, doing a little 1 and 2 trick when I don't see any younger folks at the home. I can understand that. But when you talk about young persons there, and I have to be, you know, removing or pulling up my mask or trying to find something to put under my mask to make it smell a little bit better, because I don't want to die from, you know, the odor itself. Like, I cannot understand how we put on our clothes and leave the home looking that good, like $1 million person, wearing a Louis Vuitton bag. You know, you're wearing a Marc Jacobs perfume, but yet still when you go inside, the home is in a terrible condition. It is in a terrible condition. We need to do better. We need to do better. We can't have our relatives living in some conditions that are just, asking us to help them. We cannot do that. We need to take a little bit more responsibility for our home environment, for our relatives, in order for them to, be a little bit more comfortable. Them already uncomfortable being sick. The least we can do is get the environment a little bit more conducive for living. That's the least we can do, The least we can do is get the environment a little bit more conducive for living. And sometimes people say, yes, but this is what they have. I understand that it is what we have, but it doesn't mean that because, you live outside, you can't pick up the garbage that is around your home. That is home. Make it still look presentable. You understand? It was on my mind because I'm like, this is just something that we struggle with as well in the hospital, because sometimes persons come to the hospital and they come with their relatives, and then the relatives are so needy. They're so needy. They want you to wash, scrub, and when you're looking, you're wondering, you're doing your best, and they're finding so much faults with the little that you cannot do in the hospital setting. You cannot do the little that you can do in the hospital setting, but yet still the patients are coming in a horrible condition, and they're expecting you to give them the 5-star. If you give them 4.9 star rating, they complain. You understand? But because you cannot do the 5-star care in terms of washing down and scrubbing all of the creeps and crevices of these patients, you hear sometimes that you're not doing a good job. But really and truly, it starts from in the home. If the patients were well taken care of from home, they wouldn't have that much creeps and crevices to go through in the hospital. The situation out there, it's awful for some of these patients already. So let us just try and see how we can do our part. Play our part from home. Make sure so our relatives them clean. Sometimes I've heard persons come and say, oh, they want the toenail to get clipped. This is in the emergency setting, the emergency room. And in my mind, I'm wondering, so at what point did we realize that the toenail is now an emergency? At what point do we realize that a toenail is an emergency for the emergency room setting? That has been there for a while. That has been there for a while. So let us just go ahead and try to make sure that we address the patient's need from home. So when they come to the hospital, it can be a little bit more a meaningful experience for them. Because if we're not able to cut them toenail in the hospital, in the emergency room, we get upset. You understand? So let us just make it be a meaningful experience for the patients and play our part by starting at home with, the cleanliness of the patient. Because if we were taking care of our patients and our relatives at home, then they wouldn't be in the condition that some of them are in. And I'm not talking about the homeless population. I'm talking about the ones who have young people living, eating, sleeping in the same house, the same yard. Whether it is uptown, the house be, or downtown, the house is. I'm talking about those same patients, those same homes where we have patients living in. We have young people there living. Please take care of our relatives. So as young persons, let us just play our part and take care of our relatives. Take care of the persons that we're living with. You understand? It's already hard for them going through whatever sickness they have. So just do your part while you're there as family members and help them out as much as you possibly can. It can't be a case where you have one house, the parents are living in a slum, because that's the picture you get when you get in there. You know, that's the picture you get in some of the homes. And then when you look, you see people that are young, healthy, able-bodied, living, looking like a queen, because they're neglecting, they forgot about the care of their own relative. Let's just not do that, you know. Put ourselves in the position of these patients, of our relatives themselves, and help them out as we possibly can. You understand? Help them out as we possibly can. We cannot just be relying on home health. We cannot just be relying on a home aid nurse to come. We cannot just be relying on nursing home if the patients are able to go in there. You know, we cannot just be relying on assisted living and group homes. Play your part in trying to help out, because every little counts. You understand? Every little counts. Even if you're not able to change them off completely and bathe them down and do everything, if it means that they can put on a little clean shirt on them per day, if they eat and they mess up them clothes, if it means that they can just put on two little, you know, one button shirt on them so they can feel a little bit more cleaner, rather than having them in the home soak in their diaper, the incontinent pad is on the bed and it's like torn up. You know, let's just try and see if we can do that little to help out with these patients. All right, until then, I do hope that you get the understanding of what I'm trying here to say, because it's just something that we really need to address on a personal and individual basis. All right, we need to address it individually, look into ourselves and make sure that whatever we're doing for our relatives or sick relatives, make sure that, you know, it is something that you would want to be done for yourself. If them live with you, take care of them, give them the best care you can give them. It's not necessarily just providing only food. They need food, but they also need a little bit of a wash down. You understand? Them mouth need to wipe up, them teeth need to brush, that kind of thing, you know. Give them a little extra care. Just look on them a little bit more, you know, as a family member or relative living with them. All right, until then, thank you so much for tuning in, and I do hope that you will have a wonderful day. Bye.